So you always want to have clean, dry skin before you use the device. So first wash your face, and then you're gonna plug the device in, and then you'll choose which electrode you want to use. This mushroom shape is really nice to use on the cheeks because it's a little bit of a bigger area. The spoon shape one you can even get under your eyes. And the pointed shape one is really great for pimples and cystic acne to really spot treat. You can also use the back of this one if you want to use a larger area, or even get, in on here or in on your neck. So what you're going to do is you're going to just simply pop the electrode in. You're going to turn the device on, and you'll start to hear a buzzing noise. When you put it on your skin, you want to feel about like a 5 on a 1 to 10, about a 5 tingling sensation. Don't go too high. If you crank it up too high, you can dry out your skin. You're going to compound the problem with the acne. So no more than a 5. You want to use it no more than a couple minutes on any given spot or acne lesion, and no more than 15 to 20 minutes all over your whole face. You can safely use this daily. You want to make sure that you follow up with the appropriate topical solutions and hydration to ensure that you're not drying your skin out. One of the things that's kind of interesting about the device is the further away from your skin it is, the deeper the penetration. So I like to use gauze, and for 2 reasons. One, it does drive that the tingling sensation a little deeper into the skin, and it also makes it much easier to maneuver the device around your face. So you don't want to go any more than a 1/4 inch thick. So you can take a square gauze piece. If you want, you can keep it at this flat, or you could even fold it over a little bit. You're going to turn the device on. You're going to hear that kind of tingling sensation. Now, if you hold your finger on the electrode and put it on your face, you're not going to feel anything because it's grounded. So the minute you take your finger off, you're going to start to feel a slight tingling sensation. If you put the gauze on and remove it, you're going to feel it a little bit deeper. And you can really tell by moving that away from the skin, I can feel it's a lot more tingly. And so this will allow you to also more easily maneuver it around your face. And the other thing that you can do is if you have a pimple or a cystic spot there, you can, what we do is call sparking. You can spark it to get it a little bit deeper, and then continue to maneuver in like a circular motion. Now, the scent that you're going to be smelling is ozone, because that's what this is happening. Argon gas in the electrode, when it touches the skin, is generating oxygen or ozone. So you're going to have that scent that you're going to smell. Don't be freaked out. Your skin isn't burning. What you're smelling is ozone. The electrodes are really simple to remove. Make sure you always turn off the device. And then I like to take a tissue. If you're using gauze, you can go ahead and use the gauze. They are glass, so it's better to be safe. You can just pull it straight out. And then you can just wipe it down with some alcohol, and then you're going to put it back in the case. And then again, if you want to use a different electrode, you can just put it right into the device, turn it on, ground it with your finger, put your gauze on your face, and then begin the treatment. Now, for your hair, you can use a gauze if you want. I wouldn't necessarily recommend it. I would go ahead and just turn the device on, get to a comfortable tingling sensation, and go ahead and work in whatever areas of the scalp where you're noticing some hair loss. Again, you're just going to turn the device off, use the gauze to pull it straight out, and then again you can disinfect it with alcohol. Just spray it on, wipe it off, and put it back in your container.